Chapter 17. A Psychiatrist Works with MHD Control. In the past several chapters, José explained mind control and gave detailed instructions on how you can put much of it to work. You can see that very deep levels of consciousness are involved in mind control, and you may wonder, as others have, whether you face any dangers as you explore, perhaps for the first time, the powerful depths of your own mind. José and those close to him in directing the mind control organization say that experience so far shows that the benefits of the training are not in even the smallest way offset by any untoward side effects, to use a medical phrase. Putting it another way, no one who has taken the course is any the worse for it, as far as José and his colleagues know. One mind control graduate, a member of the medical profession, has put mind control's safety to an acid test. He is Dr. Clancy D. Mackenzie, a prominent Philadelphia psychiatrist and psychoanalyst, director of the Philadelphia Psychiatric Consultation Service, member of the staff of the Philadelphia Psychiatric Center, and in active private practice. He is also a longtime student of yoga and other meditational disciplines, biofeedback, and parapsychology. As part of his studies in these fields, he enrolled in the mind control course in 1970. I wanted to see if they were actually teaching clairvoyance, as a number of my patients who had benefited from the course reported to me. I became convinced that something psychic was taking place, and I have since devoted a good deal of time and thought to investigating it further. Two other things sparked his interest in mind control: a comment made by Sigmund Freud toward the end of his career, and something that happened in a mind control class. Freud had said that the most promising direction for psychotherapy to take in the future is toward mobilize a tie-in of the patient's energies. Dr. Mackenzie clearly saw people in the mind control class using energies they never knew they had. But he saw something else in this class. 3% out of the 30 were emotionally disturbed, and there was a fourth whose stability was in question. What was the reason? Did the course precipitate emotional illness, or had they been ill when they arrived? Were my own disturbed patients who had benefited from the course merely lucky? The most practical way to find out, he reasoned, was to test people before and after the course. The test would be to observe closely those who were the most psychologically vulnerable. He and a colleague, Dr. Lance S. Wright, professor of psychiatry at the University of Pennsylvania, launched a study. During the fall, following 4.5 years, 189 psychiatric patients volunteered to go through mind control training. To make the test still more stringent, they focused an even more detailed study on those in this group who were psychotic, borderline psychotic, or who had recovered from psychosis. There were 75 of these. From their observations of the beneficial effect of the course on healthy people, the results of these tests were no surprise to Dr. Mackenzie and Dr. Wright. There was consistent improvement in mental health among the psychiatric patients. For those interested in the close reasoning and tight controls that guide scientific studies, here are some details. Of the 75 patients in the disturbed group, 66 were from Dr. Mackenzie's practice. They represented 100% of his psychotic and borderline psychotic patients who were willing to take the course. At the outset of the study, patients were sent cautiously one at a time so they could be monitored closely for any ill effects on themselves or the class. Also, they were sent during what Dr. Mackenzie describes as their more stable periods. Later he found he could send patients during their less stable periods, went while they were actively delusional. Still later he felt comfortable sending several disturbed patients at a time, sometimes 6 or more. As part of his study, he tested 58 of these patients before and after the course to see what changes it might cause. The test, the Experiential World Inventory, consists of 400 questions designed to measure a person's perception of reality, something like the famous Rorschach inkblot test, but in written form. The difference between the before and after scores was impressive. 36 showed dramatic improvement in reality perception, 21 remained about the same, and 1 showed a drop. The person whose score dropped was a 29-year-old catatonic schizophrenic who, for the first time in his life, stopped taking medication and began ing. Clinically, observed Dr. Mackenzie, he had more emotional energy and a brighter outlook following the training. However, the dating threw him into conflict and he became disturbed 2 weeks after the course. He did not require hospitalization. All these patients, of course, had been in psychotherapy, many for a year or more, which gave Dr. Mackenzie an excellent opportunity to see what actual clinical changes had taken place after the course. Here are some of his findings. One patient, a 30-year-old schizophrenic, earlier in his life had believed he was under orders, sent telepathically, to kill someone. Fortunately, he could never find the right person. During therapy sessions after the course, he was able to discuss his delusional system for the first time. His emotional energy was much greater, and he had a brighter outlook on life. Soon he returned to school to earn a PhD. His ability to do so was directly related to his taking the course, explains Dr. Mackenzie. Of 28 patients suffering from various types of depression, involutional, psychotic, schizoaffective, and manic depressive, 26 felt pleasantly better after the course. The other 2, who reported feeling more depressed, not only scored better on the questionnaire but, like the others, were able to work through problems they had been unable to deal with before. A 21-year-old woman was determined to commit suicide and was in the early stage of acute psychosis. She assured Dr. Mackenzie that nothing he could do would help, she would commit suicide anyway. He recommended that she take the course. By the end of the week he was absolutely amazed, she responded better than any of the other patients had. It was one of the most dramatic remissions I had ever seen. She found a new calm, was more rational, and her thoughts no longer raced in quickly changing directions. Just as important, most of her burden of pessimism was lifted. In a clinical report, Drs. Mackenzie and Wright say, hospitalization and high doses of medication could not have calmed her as much. She repeated the course 2 weeks later and again there was improvement. The changes were dramatic, she was better able to work in therapy over the next 6 months. A year later, Dr. Mackenzie found her fully recovered from her acute illness. Psychoses, of course, are severe mental disorders. Neuroses are far less severe. Of the 189 patients who took mind control, 114 were suffering only from neuroses. All of these benefited too. Summarizing their clinical findings in the aforementioned paper, the doctors wrote, those who continued to practice mind control after the training were able greatly to alter their lives by it, and even those who did not practice it were able to use it in time of crisis, when they had to cope with stress or had important decisions to make. For everyone it seemed to be a mind expansion experience, a revelation that they could use their mind in other ways. Group enthusiasm mounted toward the end of the course and most persons experienced a higher emotional energy. The disturbed group also showed an impressive change clinically. Only the one mentioned, the 29-year-old who had just begun dating, became more upset, and the others at least derived some benefit from the training. Many persons with flat affect, little or no emotional response, showed enthusiasm about something for the first time. There did seem to be a change in emotional energy after the course and an improvement in affect. They had a more positive outlook about their future, and for some there was a better understanding of their psychotic processes. The delusional patients were clearly less delusional after the training. There was a greater relaxation and lessening of anxiety. Patients learned to rely on their own resources to understand, cope with and solve problems, and to be able to do so gave them more confidence. With all but one of the 189 patients benefiting from the course, Dr. Mackenzie concludes that it is more than just safe and beneficial, it can be immensely useful as an integral part of psychotherapy. He now has almost all his patients take the course. Some of them shorten the length of their therapy by as much as 2 years with mind control techniques. One of these techniques, dream control, he says, may very well prove to be a major breakthrough in psychiatry. It is a swift and reliable way to understand and solve problems. Trained in Freudian analysis, Dr. Mackenzie sees no conflict between the way Freudians interpret spontaneous dreams and the way mind control graduates interpret their programmed dreams. The Freudian dream wish becomes the wish to have the answer, he explains. However, he cautions, it is necessary to make certain an unconscious dream wish did not supersede the conscious wish to have the answer. A patient whom Dr. Mackenzie had been treating for some time called to say she was about to be admitted to a hospital because of chest and stomach pains. He told her he wanted her in a psychiatric hospital instead. The call was no surprise, he had seen this coming for some time. Her mental condition had been worsening. In the psychiatric hospital, Dr. Mackenzie told her to program a dream to answer 4 questions. What is the problem? Where is it? What caused it? How can I get rid of it? Here is what she dreamed. She, her husband, and their 3 children were driving along a winding road. It began to snow and the car slid off the road. Soon the car was covered with snow. Her husband told her to cut off the engine, then 8 or 10 people came from the city to dig them out. When they emerged from the car, their 3 children were gone. Just ahead, the road came to a dead end. Another road went off at a right angle into another road at a right angle, which in turn led to still another road. A superhighway, also at a right angle. As he heard her recount this dream, Dr. Mackenzie suspected she was describing an intestinal tract and asked her to draw a map of the winding road. She did, and, sure enough, the road accurately followed the course of a human intestinal tract, all in correct proportion. What's more, a later medical examination found an obstruction at a spot corresponding exactly with where her car slid from the road, where the small intestine meets the large one. In other words, this woman's dream, she knew almost nothing about anatomy. She is a high school dropout, accurately pinpointed her obstruction in a 1-inch segment of a 20-foot human intestinal tract. Still more, the snow, according to the symbolism of her dream, was a dairy product which caused her intestinal upset and in some way triggered the buildup of the obstruction. Her husband's advice to cut off the engine was, again, in symbolic form, the best advice she could get. It meant, shut off the fuel supply to the body, stop eating. The 8 or 10 persons who dug them out are, in dream language, the fingers of the 2 hands. This may represent the healing, laying on of hands, or surgery. The sudden absence of the children was wish fulfillment. She wanted them out of the way to get more of her husband's attention for herself. Dr. Mackenzie had her transferred to a medical hospital because, normally, an intestinal obstruction like this calls for immediate surgery. However, armed with this understanding of her dream and with the knoll edge, gained in mind control class, of the power of the mind over the body, plus the anticipation of surgery, she began to release the obstruction. An hour after Dr. Mackenzie's dream-based diagnosis was medically confirmed at the hospital, she had freed herself of the obstruction and no surgery was necessary. Her surgeon was amazed. Dr. Mackenzie later learned that this woman had had surgery for an intestinal obstruction 4 times in the past 20 years, and her surgeons told him that each time it had been in the same place. It appeared she had learned to produce the illness whenever there was a psychological need for it. Later, this woman's 18-year-old daughter came to him with a problem. She was pregnant and unmarried. "What on earth should I do?" she asked. Once again he advised dream control to find the answer. In her dream, a man appeared. He said, "Have the baby, wait 3 years, marry the man, then move out of the state." I couldn't have given her better advice, Dr. Mackenzie said. The divorce rate among teenagers is 80%, so 3 years waiting at home was logical. The man was the right person for her, but for a successful marriage they would be better off away from home, far from parents. In another case, dream control led to a totally new therapeutic technique, which saved years of therapy time. This patient's problem was that whenever her husband was more than 10 minutes late for dinner, she slashed her wrists. For months Dr. Mackenzie tried to explain that, while she thought she was responding to her husband's tardiness, she was actually experiencing an earlier feeling, from childhood, when her alcoholic father would not come home. Once she understood this, she would stop her wrist slashing, but Dr. Mackenzie was not getting through. The way things were going, the woman faced 2 more years of twice-a-week therapy. Dr. Mackenzie suggested that she program a dream. Her dream turned out to be an amazingly creative one, which solved her problem overnight. She dreamed that Dr. Mackenzie taped some statements that upset her the most. She played this tape at home and recorded her reactions to it on a second tape. Then she played the second tape for Dr. Mackenzie to interpret. To each of his interpretations she exclaimed, "Oh, how stupid of me." His interpretations pointed out that she was confusing 2 different realities, past and present. Her dream led her to understand this for the first time. She never slashed her wrists again. This remarkable programmed dream cured the patient altogether. A 3-year follow-up confirmed that she remained well, Dr. Mackenzie reported. Another patient suffered from claustrophobia, and he struggled for more than a year to get at its cause. It turned out to be an interesting one. In a programmed dream, he and 3 other persons were in a rectangle outlined by a rope on the ground. Outside this rectangle, at one corner, was a smaller one, also outlined by a rope. Everyone was trying to get out of the larger rectangle through the smaller one. The significance of this dream becomes clear when you see the larger area as the womb, the smaller one as the cervix. Outside was a green pasture with cows' breasts. One of the patient's companions ran toward the smaller rectangle but was stopped by an invisible barrier, the uterine wall. A string of tin cans was attached to him near his belt buckle, an umbilical cord. The patient knew that somehow he would have to get out of there, but he decided to let the others go first. It gave him a sort of nervous feeling, like giving a speech, something he knew he had to do even though it caused stress and anxiety, birth trauma, but there was relief after it was over. The other three in the rectangle were his brothers and sister. This one dream gave him the insight he needed into his claustrophobia. What makes the dream particularly interesting is not that it takes a person back prior to birth, this is fairly common, but its reference to the invisible barrier. Asterisk does this, Dr. Mackenzie wonders, suggest the possibility of clairvoyance prior to birth. Dr. Mackenzie not only advises his patients to use mind control, he uses it himself to help his patients. Some of the most amazing wisdom comes to me when I'm using dream control. One night he programmed a dream about a patient in psychoanalysis, a 27-year-old man who had not dated in 2 years. Women were against him, and besides, they were no good. In his dream, Dr. Mackenzie heard himself say, "It's okay with me if you never have a heterosexual relationship." Next time the patient complained about women, that is exactly what Dr. Mackenzie said to him. It worked. The patient was stunned, avoiding WOM, and was his way of resisting treatment. Now it would no longer work. Besides, he was panicked when he thought of never having a healthy relationship with a woman. That night he did. Dr. Mackenzie, who has become a consultant to Silva Mind Control, continues to search for new ways to use mind control to improve and speed up psychiatric treatment. At the same time, he is looking for ways to use mind control in far broader areas of medical practice, in the diagnosis of illnesses. The first step in this search is to find ways of measure the reliability of mind control's technique of work cases. After 3 years of research, he believes he is coming close to what he terms an absolute research design, one that eliminates all the variables and may assures only what it sets out to measure. His purpose is to find ways to put case working to medical use. Medical diagnosis sometimes involves exploratory surgery or drugs that may cause discomfort or danger to the patient, and no diagnostic technique is accurate all the time. Psychic diagnosis would pose no hazard for the patient, provided its reliability can be demonstrated. This is what Dr. Mackenzie is working on. The first time he tried his new research design was in a mind control graduate class of 30 persons. The accuracy of the results was greater than what chance would produce by 200 to 1. He was encouraged, but he wanted to refine his methods even more and to arrange for the scoring to be computerized. He checked out his plans with the statistics department of the University of Pennsylvania, and they agreed that he had indeed eliminated the variables that plague psychic research and that his measurements would be accurate. The Mind Control newsletter published drawings of 2 human bodies, see pages 134 to 35, with circles for readers to check. They were given, as in case work, the purpose of this experiment is to correctly detect the location of the abnormality or illness. Please limit your activities to detection so as not to affect the illness during the experiment. Case A. Instructions. 1. Debbie Vecchio is 23 years old and lives in Miami, Florida. She has a medical problem that you may be able to help. Please go to your mind control level and picture or imagine Debbie, with a desire on your part to locate her illness. When you think you have located her illness, fill in 1. Circle only on diagram nearest where you sensed or guessed it to be. Important, if you fill in more than 1 circle per diagram, your answer will be disqualified. Allow at least 10 minutes to elapse before going on to case B. 2. Cynthia Cohen is 21 years old and lives in Miami, Florida. She has a medical problem that you may be able to help. Please go to your mind control level and picture or imagine Cynthia, with a desire on your part to locate her illness. When you think you have located her illness, fill in 1. Circle only in diagram B, nearest where you sensed or guessed it to be. B. Cause the nature of this experiment involves detection only, do not send corrective healing until. Case B. Name, age, sex, and location of two persons who were ill. What they were not given, what Dr. Mackenzie himself did not know, was the nature of the illnesses. The Florida physician who gave him the cases was to reveal this only after results were in. Doing 2 cases rather than 1 is central to the new research design. This permits Dr. Mackenzie to weed out all the guesses. For example, if patient A but not patient B had an injury to the left ankle, any circles checked on patient B's left ankle would be guesses. If 5 readers guessed B's left ankle, it is reasonable to assume that the same number would be guessing A's. Now suppose 50 readers checked A's left ankle. Dr. Mackenzie would subtract 5 from this number as guesses and conclude that 45 were operating psychically. The computer would then measure the statistical significance of the results. For this to work, the 2 cases must be different. If they both had injured left ankles, this method of weed out the non-psychic answers could not be used. The Florida physician goofed. He supplied 2 cases which, it turned out, had injuries to the same area of the body. Dr. Mackenzie had to change his plans and study the results some other way. Instead of comparing case A with case B, he compared the number of correct responses with the next largest number of responses. Although the computer told him the results could have happened by chance only once in almost a billion times, he still does not consider his experiment conclusive because his research design could not be followed. There are many more facets to his design than are outlined here, and he has conducted many other experiments that produced what he terms statistically significant results. His entire project is so significant that we will surely hear more about it when he has refined his technique even more. Instead of simply having them check a circle to indicate the location of an illness, he will give mind control graduates lists of medical ailments to check, thereby providing specific diagnosis. These preliminary studies, he said, point toward high levels of statistical significance. I am not ready, though, to draw conclusions from them. A lot more painstaking work is needed. If later studies are equally encouraging, we may have a way of putting psychics to work to help physicians in their diagnosis in ways even more reliable than those being used now. This just could turn out to be a medical breakthrough. It's too early to say for sure, but that's what I'm working toward. Mind Control's research director, J. Wilfred Hahn, a biochemist and former president of Mind Science Foundation, shares Dr. Mackenzie's hopes. Ever since the 19th century, when the scientific method was brought to bear on psychic research, uncontrolled, sometimes unknown, variables left questions hanging over the findings. Whether Dr. Mackenzie achieves a medical breakthrough is, as he says, yet to be determined. But I believe he has already achieved a breakthrough in his research method. From all the data he gathers, he can concentrate the psychic responses, he can eliminate all the garbage, leaving only what he wants to study, just as a chemist studying a single trace element in water can eliminate the water and all other elements except the one he wants to study.